We're about to start our weekly singing group for people with long-term illnesses and older people to promote health and well-being and to prevent people getting more ill and prevent deterioration, prevent depression and prevent isolation. People who come here, they've got illnesses, long-term illnesses like Parkinson's, breathing difficulties, asthma or others. People generally find that their breathing improves a lot through attending. After they've attended for a few weeks, they really feel the difference. People who come here get a lot less infections and they need less medication. They go to hospitals less than they would without the group. And people have come off, for instance, blood pressure medication because their blood pressure has come down through the relaxation here.
Anybody with any kind of a health problem will be helped by coming here. As I say, there's so many different beneficial sides to it.
I've got one of the little blue inhalers which you're supposed to use when you're short of breath. And these days I hardly use it at all. What I try and do is use what I've been taught at these classes to get my breathing back under control.
Well, because it seems to open up your lungs, it helps it all to open up, and I've felt so much better since I started.
The exercises help me relax my body and my mind because I need to be relaxed, because I say I'm on very high medication for my blood pressure.
My chest is better. I haven't had any, they call them exacerbations. And so I've just been so much better. I haven't had to go to the doctors at all recently, and before I was going in the winter several times.
I was under the cardiac clinic up at the Sussex County, and then October, I think it was last year, I was discharged, and I think that was wonderful, and I'm sure it was to do with this exercising and singing. Yeah.
2 years ago I had a very, very serious chest infection which made me quite poorly, and they put me on a new kind of puffer which I had to have 2 in the morning and 2 in the evening until my doctor said no. I had to keep on that all the time, and then when I had my asthma review just before Christmas, they said there was such a great improvement that I don't only need it once in the morning and once in the evening, and now it's tailing off completely. So yes, I can say that I feel great improvement.
I have had a lung capacity test, and one of the measures was improved. My doctor did it for me, so yes, it has made a difference.
Well, it's something that I was bothered about, and now I'm not bothered about it anymore. I don't even think about it. I don't wheeze anymore, and to me it's almost been a magic cure.
I think if more people would come to this, it would make a difference to their lives.
I do like to be beside the seaside. I do like to be beside the sea. I do like to stroll along the prom, where the grasslands play jiggly-om-pom-pom.
Quite a few of our people live in isolated conditions, and our groups are the only time they get out in the week. So they look forward to the groups all week, and it's the only time they socialize. We have a tea break in the middle of our singing group, where people sit together and talk together and have tea and biscuits together. And through the singing and the uplifting effect of the singing and the unifying effect of the singing, they get a sense of well-being and sharing and being uplifted together, and which enables them much more to form friendships.
I've made some really good friends here.
It's like being with friends that you've had all your life.
People care about you. If you're off for a couple of weeks, people say, where were you? You're better now.
I mean, you make friends with the people that are here. If somebody isn't too good, we're all concerned about that somebody, and always very pleased to see them back if they've been away.
We go out at Christmas, we go out for a meal together, and we all talk to each other, you know, we all care about each other.
We go out like for meals about 3 times a year, and it's very nice because all the ladies are very nice because it's a different conversation.
It's just like family. It's what it's like a huge family.
I would welcome if more and more GPs could refer us people. I mean, we work together with occupational therapists and physiotherapists and Parkinson's nurse, and they refer patients. But it would be nice if more GPs would send us people as well. The Parkinson Society has taught us that their posture improves a lot, and the condition and people's condition gets much more stable as well, and they learn people can project their voices better, which is a side effect of Parkinson's disease, that the voice gets quite small.
I was actually referred through my speech therapist, and she said it will help me to breathe better and to project my voice better.
I think belting out the songs encourages you to use your voice box, you know, to sort of project your voice a bit more.
And when I can't come to the groups, there's a big difference in my voice. It really helps me.
Well, I think things have progressed with the Parkinson's, but I think it helps to keep a hold on it, if you know what I mean.
Everybody says I'm doing really well, and I put it down to coming to this group. They're helping my bad hand, which gets stiff and shaky. Those exercises I was just doing, they really help.
It's, as I say, it lifts my spirits. It helps you to relax a bit. When your muscles tense up and you slow down.
That's the other thing. Adita teaches you how to breathe properly, and it's not something you think about, but she brings it to your attention.
Well, I work in education, partly teaching children and partly training adults. So my voice is actually my most important asset. I went in to see a consultant about it, and they were obviously testing everything and saying vocal cords are fine, everything's fine. It's actually a neurological procedure that is making my voice too soft. So having the exercises that we're taught in the group helps greatly because it opens up this area. So the first immediate impact that joining this group had on me was actually that I was able to keep my work going.
We sing songs that people like. So I listen to what songs they ask us to sing. We've got a lot of Elvis Presley songs. We've got Beatles, show tunes, Vera Lynn, and songs like that, all that people remember from the past and feel familiar with. And also the songs that are uplifting and songs about love, that they feel supported and they can find this place in themselves, this place of love. Welcome all of you. We've got a few new people today. So welcome Sheila.
Whenever you go, whenever you go to a new group, you always feel apprehensive that, you might be, they might be cliquey or something. It's completely not like that, they're incredibly friendly and welcoming.
I was diagnosed with breast cancer last summer. That was on a Thursday. On the Friday morning, Roger said, "You're coming with me," because he didn't want to leave me in the house on my own. And I've been coming ever since.
It's so marvellous. I came at the first because I wanted to, because I spend a lot of time on my own, and since coming it's been such a wonderful experience, and I'm so glad when I can come out and get here and manage to be here.
You get a lot of anger in the world today, so much anger. You never get anger here. We're all such lovely people, and an hour and a half with these people you leave on a high.
It's a huge boost. It lifts your mood. It helps your mood. It takes away all the tension.
It's the fellowship really here. It's a really friendly group, and they support you through everything.
We do breathing exercises, which I do at home as well.
And a lot of the exercises are similar to the ones that the care unit give you to do.
But it isn't just that, it's the whole spirit of the class. It's very positive. You can guarantee that you will enjoy it when you come, and you always leave feeling happy.
So although I haven't got breathing problems, I find just being here and singing has helped me.
It promotes contentment and happiness.
I look forward to this. It's a great way to start the week. Because you've got a combination of like relaxation and breathing exercises. Then you have a good old sing-song.
It's fun and it's lively and it lifts your spirits as well as exercise and breathing and belting out the songs. Probably very flat, but belting them out nevertheless.
I actually feel much better for my singing. Nobody here would tell you they can sing, but collectively I think we make quite a nice noise.
We don't have wonderful singing voices, but that doesn't matter because you never ever have to sing on your own. You just all sing together and you're all uplifted.
And I don't like to miss it at all because I really enjoy coming. And then I always feel I would go out singing, get on the bus, and then I get one song in my head and it lasts all week.
It's always hardest to make the first step, to get out first. And if you've got a friend that would say, "Oh, come on, give it a whack, and you might enjoy it."
Come here and experience the group and see the people, how they are now, and maybe come back in a couple of months and see the change in the people and see the people when they come in here and see the people when they leave and see the difference and see their laughter and the smile on their face and how they enjoy it and how they feel uplifted, and see for yourself. Some of the ladies said, "Oh, it's as good as drinking some whiskey. I feel so happy afterwards and so high. I always leave on a high."